Kristen, if you can just tell us a brief history and where you live and your truth today.
I'm in Ontario, Canada. I've been a nurse for 14 years, and 12 of that I have spent in the NICU, so neonatal intensive care unit, looking after preemies. Prior to that was in pediatrics. And throughout my, journey throughout nursing and then becoming a mother, I started to kind of uncover, more information about food. And, I thought I knew about health and was always into fitness and eating well. But then I started to learn a lot about like the corruption around food, and which kind of just led me to kind of peeling back more layers, and peeling back kind of like blinders, and realizing the scope of kind of what was going on in the medical system with our children, and then the babies that I looked after. And so I'm concerned with where healthcare is going. And I went back to school to become a holistic nutritionist. And that's where the blinders really came off, and peeled back more layers, and just learned so much more that was never really taught to us in school about preventative care and true health and well-being, and about food and the immune system and mindset and mental health and all those things. So I've been speaking up just against the lockdowns, and about more so for our kids, about what it's doing to them, what the masks are doing, raising them in fear of each other, fear of the air they breathe, fear of that they might go and harm their grandma or a parent. And I'm very concerned about what all this language and conditioning is doing for our future generations. So I'm speaking out for that. Also, all the medicines that are being pushed on our young children right from birth and beyond, and what it's doing to them. I'm seeing so much rise in just sickness and autoimmune diseases. And as a nutritionist, I specialized in kids. So I had parents come to me a lot with just behavioral skin conditions, just the kids always being sick. I saw a lot coming in, and so I got really concerned about what was happening to these children. So I've been speaking out for our kids, and I'll continue to fight for them for their future. Mm-hmm.
And do you want to discuss what happened when you spoke out?
Yeah, so kind of with Sarah there, so also suspended and investigated, so not really able to kind of push, question the narrative. And even while working in the unit, we would see babies that were well and getting ready to go home, and they'd be, coming up to their 30-day vaccinations, they get vaccinated, and then they would be put back into the unit on breathing support. And anytime I kind of questioned this, I just got, eye rolls, and, there's no correlation. That's not, or we would just brush it off as like a common side effect. Oh yeah, they, had their immunizations today, so they, we're expecting them to have more spells, require more breathing support, or whatever. And no one kind of looks into these things. And lately we've been pushing a lot more antibiotics, prophylactic on antibiotics, so really harming their gut, which, our gut health is everything for our immune system and our future and mental behavior, everything, mood. And antivirals now are a huge thing for possible HIV in mothers. So babies that are perfectly healthy in term, we're pushing a lot of antivirals now on the babies. So I just see this, just pushing prescriptions and medicines on these beautiful, healthy babies. And I just, I'm just very concerned for what this is doing for their future.